Welcome back to NalaTalk, where we discuss updates on the field of genetic testing, especially its implementation in clinical settings. My name is Fadhli, pharmacist and product lead in Nalagenetics. Jadi, episode kali ini agak berbeda. Kita, instead of getting a new guest, hari ini kita ditemani oleh Esther, dokter in Nalagenetics, dan kita akan coba membedah kasus tentang NSAIDs. Apa kabar, Esther?
Hi, Fat. Nice to meet you. I mean, we're both matching today.
Yeah.
Padahal nggak janjian.
Yeah, nggak janjian.
Yeah, thanks for tuning in. I thought today we'll talk about something yang quite familiar to all of us gitu ya. Soalnya kalau misalnya we talk about implementation of pharmacogenomic test, mikirnya kan soal obat yang mungkin banyak orang nggak minum gitu. Tapi sebenarnya kalau NSAID itu is very common and it's something that even people of our age juga will consume gitu. Majority of us kalau misalnya ada cedera, terkilir gitu, atau any kind of injury or something that you need a pain relief from, itu bisa banget NSAID because it's over the counter, it's easy to get gitu kan from your local pharmacist. Nah, tapi today specifically, I thought we can talk about period pain gitu, something that a lot of people can relate to. Not you, mungkin specifically, cuman it's very common gitu. And statistics-wise, gitu, majority of women in their lifetime, especially in their reproductive age, tuh pasti mengalami period pain gitu, myself included. Then the first line of therapy is NSAIDs gitu, and sometimes people don't get relief from it, and we're just gonna talk about why gitu. Would that be okay?
Very interesting. Yeah, I have my wife getting period pain like almost every month, and yeah, I think it's going to be quite relatable. Yeah.
Yeah, and we hope that this can enlighten some of the viewers juga gitu kan. Soalnya I'm pretty sure from the stats it show that 18% of us are not getting relief from NSAIDs. So chances are someone out there who's listening can get new knowledge gitu about why maybe the drug is not working for them. So I might open with two of the cases that I encountered. So as a doctor myself gitu ya, when I was working in Melbourne, ada yang just in general practice gitu, when I was a student, atau later on when I was in emergency department, I saw cases where women would come in. Jadi yang the first one maybe would be like more in the general setting gitu ya, in general practice, a friend atau patients. Jadi more than one lah gitu, where they would say, "Oh my God, yeah, I've been consuming NSAIDs, tapi it's not helping for me, even though udah take according to the dose to the dosage that are recommended."
Yeah.
Then juga they're not getting a relief at all gitu from the period pain. Nah ini mungkin for people out there kayak aduh period pain doang, it's not a big deal gitu kan ya. Tapi it can be for some people. Jadi kalau misalnya ada orang yang sampai, I think a friend of mine actually, one time she passed out from the severity of the pain. Jadi dia sampai harus, jadi temannya harus sampai call ambulance gitu, and it's a big hoo-ha gitu. And sampai di rumah sakit ya obviously it needs to be investigated gitu ya. Kenapa nih sampai pingsan gitu? They run some tests gitu, make sure like the heart is okay, the brain is okay. Tapi at the end they didn't find anything gitu, and they found that it coincided with her having the period pain gitu. Jadi it can cause something yang cause it called vasovagal pain gitu ya, whereas the pain was quite severe, jadi sampai triggered syncopal event gitu, atau pre-syncopal event. Jadi maksudnya it's not something yang to be dismissed juga gitu. For all the women out there, I feel you gitu. Meskipun my own period pain is not as hard, tapi kalau misalnya I know that it can be quite debilitating for some people. especially in the first few days gitu of getting your menstrual period gitu. So I wonder, maksudnya as a pharmacist, what's your take on people who are not getting relief from this pain when you know that this pain could be potentially quite significant gitu? What could be the explanation behind that?
Iya, mungkin sebelum itu kita bisa bahas juga, Esther, kayak gimana sih kerjanya NSAIDs itu sebenarnya? Kan kita kan makan NSAIDs itu kayak contohnya kayak Voltaren atau apalagi ya kalau di Indonesia kita
ada Diclofenac, ada naproxen, ibuprofen.
Ya, terus mereka itu kerja itu kayak gimana sih sebenarnya? Jadi sebenarnya kalau misalnya kita merasakan pain, itu sebenarnya adalah cascade of a series of events di dalam badan kita. Jadi pain itu bisa dirasakan karena badan kita tuh mau memberitahukan ke kita bahwa there's some destruction inside going on, or there's something not right going on inside our body. Jadi contohnya kayak misalnya kalau lagi periods itu biasanya karena there's a heavy outflow of blood, there's a lot of like sloughing off of cells inside the uterus. Itu jadinya alasannya jadi banyak sel-sel yang rusak dan jaringan yang rusak kan. Dan ketika jaringan rusak ini, dia akan biasanya mengeluarkan signal kayak semacam molekul-molekul kecil gitu yang akan men-trigger, memberitahukan badan kita, hey, there's some destruction going on inside this body. Do something about it. And usually these molecules are called like prostaglandins, and these prostaglandins will be like these molecules that will cascade a series of events that will lead to inflammation and therefore pain. Jadi itu adalah digunakan itu untuk men-stop signalnya. Jadi gitu ketika ada semacam SMS dari badan itu untuk mengirim ke otak, dia akan memblok SMS itu dan sehingga inflamasi dan juga sakit tidak jadi terasa. Nah, apa yang diblok itu adalah suatu enzim yang namanya COX atau COX, cyclooxygenase. Jadi cyclooxygenase ini dia berfungsi sebagai perubah something called arachidonic acid, namanya aneh, tapi arachidonic acid ini adalah precursor sehingga dia akan berubah menjadi prostaglandin. Dan prostaglandin ini nih yang agak nakal untuk bikin kita rasa sakit gitu. Gitu. Jadi dalam begitu obat NSAIDs ini sendiri perlu untuk masuk ke dalam badan kita dan melakukan fungsinya. Tapi dia akan diactivate itu di dalam badan kita di bagian hati oleh enzim yang namanya CYP2C9. Jadi kalau kita bisa bayangin obat NSAID ini kalau misalnya adalah sebuah kayak apa ya, kayak sebuah makanan gitu, kalau dia masuk ke dalam hati, there's gonna be a butcher, it's gonna be dismembering it and making it.
Oh wow.
Jadi tergantung oleh aktivitas dari CYP2C9 sendiri, itu akan mendikte bagaimana efektif obat tersebut di dalam badan kita. CYP2C9 ini. Dan interestingly again, CYP2C9 ini ternyata sangat terefek oleh genetic mutations yang dalam badan kita atau genetic variations. Contohnya kayak ada orang-orang yang CYP2C9-nya inherently much faster in terms of metabolism, so that instead of like they chop one molecule per minute, they chop like 2 molecules, which is like 100% faster. And when you chop it faster like that, the concentration of medicine or concentration of NSAIDs dalam badan kita itu nggak cukup untuk bisa memblok pathway yang kita omongin tadi, sehingga pain-nya masih terasa gitu. Jadi variabilitasnya ini yang membuat efek dari NSAIDs ini sangat-sangat berbeda antara satu sama lain gitu.
Jadi you're saying, I like the chopping analogy. Jadi you're saying kalau misalnya enzimnya itu cepat, malah before the drug can take effect udah gone duluan gitu ya obatnya.
Iya, jadi itu adalah suatu fenomena yang dimana namanya adalah first pass effect. Jadi everything, all kinds of like medicine when ingested through our body kan, dia bakal diserapnya biasanya di usus. Dan di usus ini dia bakal dibawa ke hati dulu sebelum ke every part of the body.
Yep.
Karena biasanya itu kayak semacam apa namanya, it's the bouncer in the body. Kayak hati itu the bouncer. Jadi it will just check first who's coming in, and if it's something that is not usually been taken in, they will usually try to eliminate it. So every kind of medicine will go through the liver if we ingest it. Gitu.
And all of us have this C9 enzyme in our body.
Yeah, right? Yeah, that's right. It's one of the essential enzymes in our body.
We inherited from our parents, tapi especially in the Asian population, that can be quite varied, and you can inherit actually the genetic material from your parents that cause the enzyme to be either slower or normal or faster.
Yeah,
right?
That's right.
Yeah. And so what happened, you talked about when the enzyme is too fast, so like it will chop all the molecules before it can even take effect. Tapi what happens when the enzyme is slow, the CYP2C9 enzyme?
So when it's slow, it gets there's a high chance of accumulation. So instead of like effectiveness, we tend to look at the side effects. So in terms of like NSAIDs, of course, all medicine will have like its side effects, and I think I heard a famous quote by an old scientist that I learned when during pharmacy school, like what makes a medicine either poison or medicine is actually its concentration inside our body. So if there's too much of that medicine, or too much of NSAIDs inside our body, there will be like side effects. For example, like gastric bleeding. It could cause to some heart problems. It could cause mostly like nausea and vomiting, and all the rest of these nasty side effects.
Yes. So it really depends on how you are using the medications, and what you're trying to target atau kayak therapeutic effect itu apa gitu that is desired.
Exactly.
Okay, very interesting. And for NSAID ini, now that I think of it, actually, I think one of our friends did a test who claimed, that the NSAID wasn't working for her, and I think she's actually an intermediate metabolizer, but that doesn't really align with what you're saying, because normally if it's ultra, then it'd be too fast, right? And that's when you don't get the effect. But could it also be if their enzyme is slow, that you're not getting the effect that's needed because it's cleaving it too slow?
Too slowly, yeah. So we can look at it just like a binary, like either or kind of thing, because usually drugs are affected by multiple enzymes besides just the CYP2C9. So in the interesting case of that friends of ours that has a CYP2C9 intermediate metabolizer, it could be the fact that her other like receptors, like the one I mentioned, like COX or cyclooxygenase receptor, is different from the rest of the people, where there needs to be more of the drug to be present in order to be able to suppress the pain. Or it could be also the fact that the way we perceive pain is different between one and the other. What we know that kayak NSAIDs itu sebenarnya it's one of the lower rung of the painkillers, right? Jadi meskipun dia itu bisa berfungsi untuk mencegah prostaglandin cascade kan, the fact of the matter is that the pain cascade could be due to different kinds of enzymes juga, sehingga mungkin bisa aja the body, instead of like on top of triggering the prostaglandin effect, it could be triggering other kinds of receptors seperti like OPRM1 dan lain-lain. Jadi ujung-ujungnya juga kerasa, oh kok nggak ngerasa itunya, itu reduction in pain gitu.
I see. Jadi just to reiterate, there are a lot of factors that can play into it, but CYP2C9, polymorphism would be one of the factors that can influence the activity and the way the cascading effect in which that you might get relief or not so much from the medication. And you mentioned CYP2C9 ini sebenarnya involved in metabolism of other drugs juga ya. So this is the answer for a few things.
Yeah. So CYP2C9, interestingly, is like if you look at the ranking, right, it's one of the third most abundant CYP2C9 cytochrome 450 enzymes in our body. So usually the most abundant ones are CYP3A4 and CYP3A5, and the ones that is most responsible for drug metabolisms are usually CYP2D6. So CYP2C9 is somewhat likely the most low profile sibling out of all of it. Yeah,
love that.
And CYP2C9 is usually linked to, on top of NSAIDs, is also linked to like some heart medications and some psychiatric medications. So yeah, it is responsible for many different other drugs as well.
Yeah, it's interesting. Yeah, like it's like the whole family, and there's like all these different members.
Yeah.
And maybe we can get to know like the different members in another episode. But that's just so interesting to hear what CYP2C9 can do and how it impacts like NSAID metabolism. And thank you for enlightening all of us here today. Jadi for all of us mungkin yang kalau misalnya out there gitu yang thinking about why your NSAID, your pain relief medication might not work as best for you. One of the reasons could be because you have polymorphism, or like there is a genetic mutation that is passed down from your parents in your CYP2C9 gene that causes your enzyme to be a bit slower or a bit faster than normal. So that could be one of the contributing reasons. And one of the things that you can do is to take like a pharmacogenomic test, or a test that can look at your CYP2C9 polymorphism to see like which NSAID would be the best one for you to take. And maybe that will help. So in the future, you can test whether you get relief from that particular one. Or as Fadhli said, you might need just like a stronger pain medication, in which case we highly recommend for you to talk to your physician to discuss more about that. And one thing to highlight is obviously if you're experiencing pain that is beyond what is expected, I would highly recommend for you to speak to your healthcare provider, because it might not just be a period, just a normal period pain. It could be there could be underlying reasons of why you have the pain. So just a caveat for the things that we talk about today. Otherwise, keep on fighting. Hopefully you get a good relief from anything that you're taking, be it NSAID or like home remedy, or you just like tough it out like me because it's not as significant. So I'll just usually just like lay down. But hope you guys have a great day, and we will see you in the next episodes of NalaTalk. Thanks for tuning in.